feel honored as I introduce Rashtriya Ayurved Guru under Department of Ayush Government of India, Professor Vaidya Upendra Digambar Dixit sir, member of the editorial board in the new international edition of Charak Sanhita, project by Dr. Bashish, Orlando, USA and FAGD, India. Sir has worked as a member of Higher Education Committee for implementation of new education policy appointed by Government of Goa. He has a teaching experience of 34 years and clinical experience of 27 years at Ponda, Goa. Apart from chronic diseases, he has treated many acute conditions and treated more than 175 critical patients in various intensive care units of hospitals in Goa purely by Ayurveda. Sir has received various awards like National Level Hari Om Gold Medal for Best Research in Basic Principle, also Dhanvantari Award and Gamma Legend Award for outstanding contribution in the field of Ayurveda and many more. He has published many papers and articles and successfully delivered more than 155 guest lectures on Ayurveda. Sir was invited as expert in the International Symposium on Health and Inflammation organized by College of Medicine, University of Central Florida, USA. Sir is currently working as a guide for PhD at Ayurveda Department, Tilak Maharashtra Vidyapit, Pune. Now, I would like to request Sir to please start his session.
A very good morning to all of you. It's my honor to be here on the stage in the conference organized by Nanal Foundation. In my final year of BAMS and during my internship, I was very fortunate to attend the clinics of late Vaidya Bhalchandra Purushottam Nanal sir. He was not allowing many students to come to his clinic because he was very strict about that they should be studying properly. So our Guru Vaidya Chudamani Kolatkar sir requested him that you please allow some students to your clinic. So then myself and Vaidya Dhananjay Kulkarni were allowed to attend his clinic, and we were very much fortunate to learn from him. Also, we attended many lectures of Vaidya Raj Vilas Nanal sir, which were organized at the residence of Kolatkar sir and elsewhere. And I am also fortunate to receive guidance from time to time from Vaidyaraj Ramesh Nanal sir. So I am also associated in a way to this great tradition of Nanal Vaidya Parampara. So my today's topic is Rasapradosha, and based on that Ayurvedic treatment of lymphomas. Although Vaidya Ashutosh Nanal will be explaining you more about the concept of rasa, but I am here covering certain important aspects about rasa and rasa pradosh, which are relevant to the case studies which I am going to present. So you will learn these concepts and how they were applied in the actual treatment of these cases. So all of you know that tatra rasa gatau dhatu aharaha gacchati ityato rasaha. This is the nirukti of rasa. And Sushruta Samhita has described the importance of rasa as rasajam purusham vidyat. So the human body greatly depends on rasa, and even in health and in disease, rasa is very important in the human body, and that's why rasa should be, its normalcy should be maintained by annat panaccha matiman. Proper annapan should be used, and therefore shuddha rasa should be present in our body, which will be performing normal functions, and that is very important for health and to prevent diseases and in the treatment of diseases also. All of you know this verse that Vyanena rasadhaturhi vikshepojite karmana. So according to Ayurveda, what is circulating throughout the body continuously is ahara rasa. We call it as rasa samvahan, rasa vikshepan. So many people think that in modern physiology it is called as blood circulation, and therefore some people call it as rasa rakta vikshepan or like that, so that the modern people will not laugh at us that you are calling rasa samvan, we are calling blood circulation. So it is not like that. What is circulating throughout our body according to Ayurveda is ahara rasa. And this ahara rasa is carrying nutrients for all the dhatus. So all the margaga dhatu or all the poshak dhatu are being circulated throughout the body through ahara rasa. And in this ahara rasa, so it is explained by Chakrapani that rasati iti rasaha dravo dhatu ruchyate, tena rudiradinamapi dravanam grahanam bhavati. All drava dhatu are being circulated. So among all these nutrients to the dhatus, the Anjali Pariman is given, as all of you know. And in that rasa is 9 Anjali, maximum quantity of rasa is there. And therefore, Vyapadeshastu Bhuyasa, the one which is dominating, one which is in more proportion, its name is given to that combination. And that's why we call it as Rasa Samvan. If we want to call it as Rasa Rakta Samvan, then why not Rasa Rakta Mouse Medosti Majja Shukra Samvan? Because all are being circulated actually. So we can't say that. So therefore, in short, we call it as Rasa Samvan. When we say Rasa Samvan, all the nutrients are included. Now, as you all know, next to Rasa, according to Anjali Pariman, is Rakta, which is 8 Anjali in Praman. And that's why it gives the red color to the what is being circulated, we call as Rasa Samvan, but red color is provided to that. So Rakta is also being circulated, but more quantities of Rasa, and that's why we call it as Rasa Samvahan. So that's why it is scientifically appropriate term, and we should not be ashamed of that. We should be using that term only, and that is very comprehensive and appropriate term. Now the question will arise that if ahara rasa is being circulated, where is the rasa dhatu actually? So, and another question is that whether ahara rasa is separate from rasa dhatu. If it is so, can we call it as the 8th dhatu? Like that the questions will be raised, and all these questions are already raised in the commentaries, and the answer is given in Chakrapani's commentary, Bhanumati Tika on Sushruta Samhita, and in that it is said that eka eva ayam ahara rasaha dviprasthanaha. This ahara rasa is bifolded. Ahara rasa and rasa dhatu both are together, so they are not separate. So for our convenience, for understanding ahara rasa separately we are counting and rasa, but actually they are together, and that's why posha and poshak, like that two components, they are together, and that's why only 7 dhatus we consider, and ahara rasa is not the 8th dhatu therefore. And all of you know that rasavahanam srotasam hrudayam moolam dashacha dhamanyah. No need to explain about that. Now, sometimes we wonder that about srotas specifically. Some people have this question that during dissection, do we find 13 tubes separately for 13 srotas? We don't find. So why this srotas concept? So once I had gone to Bharati Vidyapit as examiner. So I asked them that your fellow colleagues in medical college, homeopathic college, dental college, they will say that we also know about human body. We never found 13 tubes over there. We never found 13 srotas. How you are finding there? So that means what is our understanding about srotas? So therefore, srotas may not be exactly 13 anatomical structures over there, but certain anatomical structures may be shared by different srotas. They may be common. So physiologically and for chikitsa, for the treatment purpose, these 13 entities are separate. They are not exactly 13. There are many. Out of that, important 13 are mentioned in the text. There only they have mentioned manova srotas, doshava srotas, and other srotas also. But 13 most important srotas. So where they are actually there. So anatomically, structurally, they may not be different. Functionally, they are different. To understand this concept, now you will be surprised that what is the relevance of this map over here in the presentation on Rasapradosha. So this is a road map of Thrissur city. M. Prasad sir is there, I think. So road map of that city. And in that city, there are a finite number of roads. But every person, suppose you will track the movement of every person, and computerized such tracks you design, that one person he moves from his residence and he takes one road and he enters into the main road, goes to his office, comes back. Another person, he takes another gully, a short road, because he finds that this is a shortcut, and then he enters on the main road, then he goes there. One person, he walks on the road and reaches his office. Another person, he takes a vehicle, he takes a car and reaches to his office. So if you will find computerized tracks of every person, that how every person moves throughout the city, then although there are finite number of roads, but you will find almost infinite, that means so many tracks of movements of these people throughout the city. So by using the same roads, different people are moving in different ways. Roads are finite, same roads. In the same way, especially for Dhatuha Srotas, the structures are the same. From Hruday, the nutrients will be thrown out into the circulation and they will reach to various, that means arteries, arterioles, capillaries, and then in the form of maybe extracellular fluid. And from there, different cells related to different dhatus, they take up their nutrients, only specific nutrients are allowed to enter into that cell. So suppose a particular nutrient which is going to give nutrition to mouse dhatu, throughout the circulation it is along with all other nutrients. But later on its path becomes different. Later on it enters into the mouse dhatu in a different way. And that's why the tracking movement of that nutrient for mouse from Hruday, that means actually from starting from the digestive tract to Hruday and to that, through that circulation into that muscle tissue actually will be different from the other nutrients which will be giving nutrition to other dhatus. And that's why physiologically their pathway of transformation, we may say, is different. And that's why different srotas exist. And therefore we are able to treat them separately, although they are using certain anatomical structures commonly. Okay. So that one thing I wanted to convey about Rasabha Srotas and in general Srotas therefore. Now what is Rasa? So all these important aspects are that it is Panchabhautik, Chaturvidhasya Chaturvidha Ahar, Shadrasa Ahar. Why all these things are important? If we want normally functioning Rasa Dhatu, then our Ahar should be consisting of all Chaturvidha Ahar. Our Ahar should be consisting of all Shadras. Then our Rasa will be performing normal functions. That is indicated by these words which are given in the texts. And yes, Tejobhuta Sara Param, so essence of the ahar, of the nutrition is converted into rasa, tasya hrudayam sthanam, and from hruday it circulates all over the body. So that is the concept. Now why rasa is very important for us? In many ways, as I told, I am not going to give all the details about all the references found in about rasa in the text, but only relevant references I have selected. So why rasa is so much important for us? Some points I am going to present that. Pushyanti tu ahara rasat rasa rudhira mausa medosti majja shukra ujansi pancha indriya dravyani and dhatu prasada saudnikani sharira sandhibandha pichhadayascha avayavaha tatra etesham dhatunam annapana rasaha prinayita. So all the other dhatus, they get their nutrition from ahara rasa, and after rasa the parinamana prakta, rasad raktam, etc. Therefore, rasa is very important. If the transformation, if the metamorphosis of rasa is proper, then the other dhatus will be also formed in proper way. And that's why rasa is very much important. If rasa dushti takes place, all other dhatus are likely to get deranged and their functions may not be performed properly. And that's why rasa dhatu is very, very important. And all other dhatus, they will depend on rasa for this purpose. And that's why maintaining normal condition of rasa is, that means rasa shuddhi, we may say, is very important. Another important aspect is given in Sushrut Samhita, Sutrasthan 15th chapter, that rasa nimittam eva sthaulyam karsham cha. Sthaulya and karsha are originated due to improper functions of rasa. So how from rasa medodushti takes place, and therefore Sthaulya and karsha are originated, that is explained by Dallan in his commentary very nicely. So Sthaulya and karsha, in that we think about med. or at the most mouse med, because mouse med are related to Bruhand, med. But that medodushti also is dependent on rasadushti many times, and that is explained by Sushrut Samhita, and that's why. And sthaulya and karsha, as you know, when a person gets sthaulya, then he can have lot of diseases, n number of diseases he can have. So many diseases he becomes prone for that as soon as he gets sthaulya. Similarly, when a person is having karsha, then he is prone to get so many diseases. And all these diseases that indirectly are related to rasa, and that's why we need to concentrate on rasa. Again, rasa is very much linked to twak, skin. That is also very important aspect, and that importance you will find in the cases which will be presented after this. So, shakha raktadaya dhatva twakcha. In that twak is mentioned, but rasa is not mentioned. Raktadaya dhatva and rasa is not mentioned. Why? Therefore, in the commentary it is described that twakcha iti twak shabdena tad ashraya rasa api gruhyate. So, rasa is closely linked with twak, and abnormalities in rasa are many times manifested on skin, and that's why rasa and skin, twak, are very much closely linked with each other. And that's why this is also very important aspect. So when we are treating diseases of skin also, we have to think about rasa. Another important aspect is that tushti, prenana, rakta, pushti, bhistu, rasaha. These are described as normal functions of rasa. And in that tushti is described, and Indu explains it as tushti mana pritihi. So prasannata, that means a pleasant state of mind, that means which is required for normal health, of mental health, that also depends on rasa. That is also linked with rasa. So if rasa dushti is there, then the effects are observed not only on the body but on mind also. If rasa dushti is there, mind also gets affected, and that is observed clinically in many patients. When we treat rasa dushti, and many times the reasons for rasa dushti are from diet, improper digestion of the diet, arm is formed, and when arm is formed, first it affects rasa dhatu, and that's why rasa dushti takes place. Many times that is the cause. There are other causes also, like rasa affects mind, inversely mind also affects rasa, that is also there. But rasa dushti can affect mind. So in many patients who are having psychiatric disorders, in them first we need to correct the digestion and rasa shuddhi we need to perform, then the other treatments work in a better way. So that's why this relation also we have to understand, and that also you will find in some of the cases which I am going to present here. Now coming to Rasapradosh. Rasapradosh is mentioned, Rasapradosh, this word is mentioned, Dhatu Pradosh, in Charak Samhita. But Dushti of these Dhatus is also mentioned in Sushrut Samhita. So in Charak and Sushrut Samhita they mentioned about this, but Vagbhat mentions only about Vruddhi and Kshay, and this Pradosh kind of concept is not means elaborated at least in Ashtang Hrudaya and Ashtang Sangraha. Of course, when I am standing here and presenting this to you, I have gone through various texts, even Kashyap Samhita, available Bel Samhita, and Bhav Prakash, Yog Ratnakar, and majority of the available text, including Gada Nigraha, then various other texts. That means whichever are available to us. But this concept of Rasapradosh is not elaborated anywhere. What exactly means Dhatu Pradosh and specifically Rasapradosh, that is explained in very brief by the commentators. So the diseases caused, which we term as Rasapradosh, Raktapradosh, etc., they are also caused by doshas. But since Dushya is Rasa or Rakta, etc., so that's why they are called as Rasapradosh Vyadhi, Rasa Dushtijanya Vyadhi, like that.